Hi guys, welcome back to another episode of the Everyday Educate podcast. I'm joined today with Catherine. How's it going?
Thank you so much. It's going great.
Awesome, wonderful. Where are you calling out of today?
I am actually right now in Las Vegas, Nevada.
Oh,
So
nice. I was just there last weekend for a trade show that we had.
very nice. Yes, a lot of shows in Nevada for
Yeah,
sure.
it sounds like every week there's something trade show business networking event going on. So
Always,
it's good.
yes.
Awesome. Well, it's a pleasure meeting you and connecting. I know we had some Instagram conversations, and I checked out some of your work. But I would just love to know from your background and who you are. So maybe you can introduce yourself, and we can go from there.
Well, thank you so much. Yes, absolutely. Um I am a speech language pathologist by trade. I am also a board certified cognitive specialist and a certified autism specialist. Um, I specialize in pediatrics and more specifically, very medically complex, severe to profound children. Um, so I do a wide variety of work, but I guess my day job, we'll kind of break it down that way, is my private practice, which specializes in autism and any very severe to profound medical needs. So that's anyone from birth to 21 from a variety of diagnoses. That could be cerebral palsy, autism, Down syndrome, chromosomal abnormalities, children who are trach invented, kiddos who graduated from NICU, which is the neonatal intensive care unit, doing complex feeding with them. Um, and so I do kind of a variety of those children. I see them like in my practice. We do both home and clinic. So that's kind of the big day job. And then I do also consult and train both clinicians and parents. Clinicians on really how I train them on getting the skills to be better with working with children with complex needs. And then parents, I have a program that I work with them on educating them on how to work with their child and to really empower them, because I truly believe that by empowering the parent, we really help the child in the long run. Teaching parents how to use their medical team as their support and not as their crutch is really kind of the gist of like what I'm trying. The goal of my programs is really to make them feel like they know what to do and they don't always just go into a doctor's office like, help me.
Yeah,
That's
I did notice like an overarching theme of empowerment. I know that's actually the name of the business, the brand. Uh, but maybe like we're in that on the other side of um, serving parents and children with autism, ADHD. Maybe not as severe, but getting products that can develop either fine motor skills or sensory
mm-hmm.
processing, or anything that can calm them down when things aren't going a specific way.
Right.
I haven't and don't have the background that you do, so I truly want to be like a sponge here and take it in, and I think the audience would benefit from your expertise as well. Um, what are some of those empowering tactics? I know there's multiple um, categories. You mentioned Down syndrome, cerebral palsy, autism. Let's stick with the autism side. What
Okay.
would be some of those empowering strategies that you guys use for parents?
So we use a variety of them, obviously, because autism, as we all know, is a spectrum. And autistic children, now I don't like thinking of it as a linear spectrum. It's more like the autism affects them all differently. And so we have to respect how it affects them. I can have a verbal child who needs a lot of support and a nonverbal child who cognitively is actually closer to what we would call an average or neurotypical, but they are cognitive likewise, but they're just not speaking, right? So getting them a device is all they need, but cognitively they don't have any real difficulties. So you can have a really big gap. Now, in terms of techniques that, we use, the biggest thing that research is pushing out is kind of this neurodiversity and Gestalt language processing. And I don't know if your audience has ever heard of those. If you're in the world of autism, those may sound familiar to some of your listeners. But what you're looking at is neurodiversity is the movement that we understand that there's a variety, and ADHD falls into this, that there is a variance in what is neurotypical of a brain structure. And autistic individuals also fall within that, depending on kind of where someone would sit on this debate, right? But the reality also has to do with Gestalt language processing. And the reason I'm saying this is because the techniques we use in the clinic have to do with the fact that our goal is not, and nor should any goal for any clinician be, that we fix your children. There is nothing wrong with a child when they have autism. There's nothing wrong with an autistic child. They just see the world so differently from us, so from the neurotypical people. And so it's more the fact that we have to better understand the way their brains work in order to help them. So techniques I would use is all of my sessions are really focused sensory wise. So depending on which sensory needs the child has, and again, your listeners may be familiar with some of these, you have children who have vestibular, proprioceptive, or interoceptive difficulties. Interoceptive is the one that's the least well known, and that has to do with potty training, hunger, thirst, temperature, body temperature, things like that. Your vestibular is your sense of balance and postural control. And then your proprioceptive is your sense of body awareness and space. Now, children can be either seeking or avoiding, or they can sometimes have both, depending on their needs. And so the most important thing that I would advise any parent with an autistic child is truly understanding their sensory needs. Because without a regulated child, they can't tap into cognition and into language. And so if your child is constantly dysregulated and you're trying to talk at them and trying to get them to tell you things, they can't do it. And I always equate that. The example I give to people is I say, if you're really angry, right, at somebody, even if you are completely neurotypical and you have verbal language, if you're really angry and really frustrated and your emotions are really heightened, if somebody's trying to make a rational argument to you, you are not going to be able to answer until you calm down. And it's the same thing with an autistic child. So I always explain it as you have to think about it as their body is kind of on fire and they're constantly they're trying to figure out how to tone it down. So they're either it's too much input, too little input, but self-regulation or mutual regulation is super important for those kids. And so I would always, and it's different. It's funny coming from a speech pathologist where I say, like, you may think that I think that language is the most important, but you can't access language without a regulated sensory system. So all of my patients, I always recommend my families to really, and I spend a lot of time working on sensory with them and with their child. I can do 45 minutes of sensory input on a kid before I even tap into language if they're having a really hard day. And some of those techniques can be really simple. Like if you have a child who is very proprioceptive seeking, so like they tend to like roughhousing, they tend to like, they're running around, they're running into walls, they push things, they like to carry heavy things. There's loads of stuff you can do in the home to really help your kid with that. Like you can do wall pushes, you can do hand pushes off the chair, you can have them load the laundry into the basket and push it down the hallway. You can put books in their backpack and strap it and let them walk around the house with it. You can also sometimes put weights on their legs to get more input into the joints on their legs. Having a trampoline in the home, having a boxing like bag for them to punch, having a sensory swing for them to crawl into. So like a sock, like sensory sock thing for them to crawl into. Those are all really good home ways to really help with that sensory input. I would say Pinterest has lots of really great things for like hard work is what you're looking for. Now, if you have a child who's more vestibular seeking, and they like to climb on things, like doing sports that will give them that vestibular input, like rock climbing, right? So using their sensory needs for functional everyday use, not stopping it. Stopping it's going to cause more difficulties. So really, I'm always like, let them work through that.
Yeah, or
So
channel that out, whichever sensory, I don't know what that the category they fall into. I don't have the clinical educational like the lingo, so I'm learning a lot. Yeah, you mentioned vestibular, proprioceptive. What was the third one?
it's interoceptive.
And
Like the third one. Yeah.
and what would be examples of that as well?
So those would be children, they can either be hypo or hyper. So hypo is meaning like they don't feel it. So these kids tend to be harder to potty train because they don't feel like when they need to go to the bathroom. Or you may feel like they're never hungry, or they don't know when they're hungry or thirsty. And so you have to have them on a very strict feeding or drinking schedule because they're not aware. They can't feel like they'll only drink once they get super dehydrated, or they get only hungry once they get starving. Hypersensitive kids will tend to, that potty training is not a problem, but basically everything inside is hyper alerted. So even if they're a little hungry, they're going to act like they're starving and they're going to eat. They're going to need to eat right now. Or if they're thirsty, they're going to act like they're so dehydrated. So it's extremes of both. It's not really kind of like this, like kind of ease. It's like really big extremes of both. So you have these needs that they have, and the interoceptive, unfortunately, doesn't have the most research on how to help those kids. It's much harder. So it's a lot working with your OT with each individual child, because you have to take into account no kid has just one of these. They usually have a combination of these in different situations. The other thing families need to be more aware of is like all these tools are great, but you can also send your kid into over alertness, right? So you can overstimulate them. You can send them in the opposite direction if you don't know what you're doing. And that's where your OT comes in, your occupational therapist. So that's why I feel like you really need the occupational therapist and the speech and language therapist have to work very closely together in order to get the best output for these children. Or else it's kind of, it's not going to be very functional or very, like, you're just going to be in therapy for a much longer time, for sure.
Yeah, this is so fascinating, and just thank you for summarizing, just enlightening me on. And I feel this in myself too. Like you talk about balance on the vestibular, like wanting to climb and sports. Like I have a sense of that. And maybe you said it falls under that neurotypical. I understand that, but then yeah, there could be a sense of heightenedness in some people when they want to climb and do adventurous things, or in other people it might be proprioceptive, rough housing and wrestling. Like I feel like it's in all of us. So I like when you say it's not about fixing, but it's about understanding that level and that diversity, and then figuring out the best way to serve them. And I had a question when you were saying not to fix. And maybe this could relate to teachers as they have special education classrooms with multiple individuals and how to handle that. What is the ideal outcome? Understanding that we want to serve our children and have them be socially, cognitively, emotionally, is it stable? Is it like, what's our goal in having them improve over time? What's kind of that ideal process where, let's say, parents, teachers can come to you and say, we started at week 1 and it was chaotic at the home and we couldn't understand. And let's say after how many weeks does it take, and what level do you guys get them to where it's like, okay, there's some routine, there's some calmness. Maybe walk us through that process.
So, like, my goal that I tell families, number one is I say my goal is to not be here, right? My goal is to empower. If I don't empower you well enough to be able to handle your own child, then I'm not doing my job. So my main goal is to work myself out of a job. That is my main goal. The second would be that I am not, we have to be also realistic about what a child can and cannot do, but I presume competence. So I presume the child can do until the child tells me they can't do. So I don't assume and sit there and give them activities that may be too easy just because they are presenting like they can't do it. Because the reality is, to be able to communicate, we need opportunities, means, and a reason. And a lot of children, by no fault of anybody's, but a lot of times when a child, especially if a child is nonverbal or has what we call non-functional language, right? So they are verbal, but they're very echolalic. And so they're not answering functionally back at you. We tend to think they can't do something. And the reality is, so then what we do is we don't give them opportunities. And I have seen clinicians do this, not just parents. And I've actually seen parents correct clinicians sometimes when clinicians do this. So it's also about like giving that child those opportunities so that they can rise to the occasion. So when I speak to my families, I'm always about, okay, the reality is more than likely the child will be in therapy long term, right? That's the reality of a child who is autistic. Now, depending on the families and how it works for them, if they want clinic therapy and they like that and that works for them, then that's the road we go by, right? I go by what works with the families and I don't have one model that fits. But the most important thing is, regardless of the child's level, regardless of what the family needs, my goal is to give the child the tools to support them to become the best versions of themselves, whatever that is. And that is the child's decision, not mine and not the parents. So the child will show me this through their actions, through the way that they interact with people and they interact with us as a team. And then that will kind of help dictate either the length of therapy or dictate what steps we take in that therapy. And so I gauge all of my sessions and all of the way that I work with the children through that lens. That number one, I'm going to work myself out of a job. Number two, I want to empower you as a parent. And number three, I'm going to give the child every opportunity, means, and reason to communicate to be the best version of themselves, whatever that is.
Yeah, I love that. Yeah, so much of that I've thought about over the years, but can't quite articulate articulate it the way that you have, so succinct and summarizing that. So thank you for that. I guess on the previous of that, like, how would this apply to teachers that have, let's say, 10 plus students with autism? And part of the reason I asked that is because in high school and a little bit after high school, I remember seeing so we had a special needs I think group, and there would be multiple teachers assigned to them, and I would always wonder, like, how does that work, and like, how do they, who's assigned to who's there specific teachers that work individually? Do a lot of what you're saying apply for teachers as well? Like, can they take this and then apply it in their classrooms?
They can, with some modifications, obviously, but they can. So most schools that have full autistic classrooms will have a speech pathologist on staff that can help the teachers and support them, as well as an occupational therapist. Now, I contract with private schools who don't necessarily have those tools. So I work with them on training teachers on how to support children in the classroom. Now, it's a little bit of a loaded question in the sense of like, I do believe that the therapy that we've done thus far with autistic individuals is not meeting their needs. And so I think that with the new research coming out, I would implore every teacher, every parent, every clinician to really kind of change our views on how we handle how we structure the programming for helping these kids. And the programming, I mean like the curriculum access, their ability to access information, understanding their sensory needs. Here's an example. Like I have a child that I assessed in a school setting who is technically, she is verbal and she is very cognitive. But her sensory profile was very enlightening because it told me that she takes in she's very sensitive to all the sensory input that's around her. But she also is what we call an avoider. And when she gets overwhelmed by that sensory input, she avoids it by eloping. And it's seen as a behavioral difficulty. However, without understanding her sensory needs, we are labeling her the wrong way, and we're not giving her the input or making her understand how to interpret the environment around her, right? So, but schools aren't set up for very sensory driven children. They're just not. And that's not their fault. It's just not. We've just not really gotten there, I don't think, as a society. And so I feel like there needs to be a shift. And this is going to be school by school, not even district by district. I think it's school by school, teacher by teacher. I would implore all teachers to really to build into their programs, into their school days, sensory breaks. And build that into so that before any cognitive, and this can work for even neurotypical kids. This does not need to be just for autistic children, but basically building in all of these sensory breaks to really give time for the body to process things will help improve cognitive function. And so that's where we have to kind of do a mind shift a little bit and it's the same thing. It goes back to my first point about how if the child is neurodiverse, it's not about making them neurotypical, because we cannot change the way their brains are wired. That is not possible. I tell that to parents all the time. I can't change the way their brain's wired. That their brain is wired the way it is. But what I can do is I can teach their brain how to use the other parts of the brain to help them better interpret a situation. So it's kind of, but if you don't present that to the child, then they can't do it because they've never been given that opportunity to do it. It's the same concept of if you want to learn a second language, there's up to a certain age before your mother tongue patterns kick in and you always have an accent. So if you learn the language before you're 12, you will not have the accent, you will sound native. After that age, your mother tongue patterns will kick in. And so you will always end up having an accent. And that's just neurological. There's nothing.
Fascinating. Yeah, truly fascinating. Um, and as far as the diagnosis, uh, whether it's vestibular, proprioceptive, interoceptive, does can occupational therapists and speech therapists essentially do that, or does it have to be their primary doctor that does that diagnosis?
No, that would be OT. I would refer to occupational therapy. Now I can see it. I can see proprioceptive interest. I can interpret all that, but I've been specifically trained for that. I have seeked out sensory training, sensory integration training. I have done like advanced autism training. So I feel very confident in my skill set to assess it and to interpret it and to come up with a sensory diet. But even with me, I will always refer to my OT for more specific things because they are more trained in that. Now, your primary doctor is really just there to help guide. They're more like, okay, you need to go see this specialist and you need to go see this specialist and you need to go see this specialist. They are not, your primary pediatrician or your family doctor are not trained in a lot of like the intricacies of developmental disorders. And so that really is the developmental pediatrician who you need to go to, who is specifically, who does an extra fellowship specializing in developmental disorders. Those unfortunately sit usually in big academic hospitals, not in small towns. So when you're in a small town, the only recourse you tend to have is your local pediatrician. So it's more about kind of using, you know, I think the one good thing that came out of COVID, right, is that it showed us that we are very connected on an internet, like virtually, right? So and I think the medical field has been forever changed by COVID from the sense of like, you have access now to doctors and specialists that I don't think you would have had access to pre-COVID. So I would implore people to really do their research looking for developmental pediatricians or finding rehab specialists like myself who help guide you in that, because it's something I actually do with both in my private practice and in my consulting. I will help families, like I will guide them through this process. Like, okay, your child is having this symptom or this symptom, like you need to go see this doctor. I want you to go like, and I did it actually for a school, like a parent. I told her, I said, your child has gross developmental delays across the board. I really would like to see a genetic panel. And she goes, well, do you think
is that a blood test or urine?
Well, it's actually looking at the chromosomes, and looking at, and kind of looking at whether or not there are any abnormalities in the DNA itself. Now, I'm not a geneticist. I can't diagnose it. And I would rather over refer than have a missing piece.
Sure.
So for me, it's really important that, if they do the work and they come back and there's nothing wrong or there's nothing abnormal, great, wonderful. Then I've ruled it out. Then that's not where it's coming from.
Yeah, truly fascinating. And, you touched up on so many things. Yeah. And even us having this conversation is part of our interconnectivity. I think anyone that's in need of something at this point has the access to find that person that has the solution or that can refer someone else or that can say give something of value. And I think even here, again, I'm on more of a very surface level. We're on the physical product, sensory toy side of things, but I'm just fascinated with wanting to understand this. And anytime people ask, just to have someone like you as a reference to point to.
Yeah.
I was thinking of something as you were saying, like sensory diets and having a program for parents, teachers, other consultants. How deep does that go? Can it go into an actual diet of what they eat? Like let's say cell phone usage or video games. Like how far and wide does what we give our children or don't give them affect them?
So there's a lot of research on this, and this would require a panel of specialists to really answer that thoroughly. I'm not going to sit here and pretend like I can answer all those facets, but what I can do is I can give you kind of like surface level, what kind of happens or what the theories are out there, right? Now, there is a lot of new research coming out, which actually, funny enough, is something that I am thinking of doing my clinical doctorate on, but I'm not sure yet. And that's how food affects autism, right? And how does it affect, and not just autism, but more like our cognition, right? So what foods we give our children, how does that affect their IQ and their ability to learn, right? And I don't have the answer to that question because I haven't done any of the research. But what I can say is anecdotally, there are people who will say that they've changed their kids' nutritional diet and it's drastically changed the way the child, is at school, and their grades have gone up or have gone down depending on whatever way they've done it. So there is anecdotal evidence out there, that there may be something to it. Now, if we break down nutrition in itself, the reality is our bodies are all chemical balances and imbalances. So our body's always trying to stay in chemical balance. And so if we eat things that throw our body out of balance, our body is going to try and counteract that to go back into balance, whatever that is. So a typical way of kind of explaining that, that's more layman's term, would be like if you're a bodybuilder who takes extra testosterone, your body is going to produce extra estrogen to counteract the synthetic testosterone, and you're going to start, you're going to start seeing, like, you're going to get more emotional, you may get mammary glands that start swelling, things like that. And so that's your body's reacting to this increase of synthetic hormone that you're putting into it. Now, people can interpret this many different ways. So I don't want to be misinterpreted in this, in the sense of like that I'm not saying there's a direct causation between processed foods and autism. That's not what I'm saying. That's not what the research supports. And it's definitely not what I'm saying. What I'm saying is that there is anecdotal evidence of kids who have already been diagnosed with autism, where parents have changed their diets and the children have changed, their behaviors have changed, right? And you can also see it in neurotypical kids. You give them less sugar, they can, you don't have these insulin spikes that you sometimes can get when you do that. So there is that. Now, with regards to the sensory diet and screen time and all that, there is research. Obviously, we all know that screen time is not good, and that we say that the children should have actually, I think there's some new research coming out that children should have actually no screen time for the first 2 years of their life, which in the modern world is almost nearly impossible, right? So, and the modern world has made it that families work ridiculously long hours to be able to support a home. And so screens become like a way to get some work done. And I do the same with my own children. I get very busy, and I'm not going to sit there and pretend like my household is with no screens. We have screens and our kids are exposed to it. But that's what the research is saying, right? That technically it's not, the first 2 years, children should not have screen time at all. Now, you could limit it to, maybe an hour a day, or you change what they watch. So sometimes having them watch things that are more educational, that require them to think. There's loads of great apps for educational tools, of puzzles and things like that they can use. Then, that's a way of working within the 21st century, but working with it, more functionally for the child's development. And sensory diets tend to only focus on getting the child their like proprioceptive, vestibular, and interoceptive needs met. That usually is the way it goes, but would I would say it never hurts for a parent to go see a pediatric nutritionist or registered dietitian to help them with getting a more balanced diet for their child. They are registered dietitians are qualified to look at calorie intake and all that kind of stuff and growth. And I think that, is always helpful to get more information on that. Now, does that mean that your child is not going to be autistic? No. That's a neurological difference in the brain. And like I said, I'll reiterate it. There is nothing wrong with an autistic child. He just sees the world different. They just see the world so differently. And we, as a society, need to learn to accept that.
Yeah, absolutely. Really well said. And yeah, I think just a lesson that I'm taking away from this, like every single person is a little different. I guess in our own way, we are a little, we have a little autism spectrum disorder. We have a little, like if we're all in this together, and we're all unique and different, and we're one and the same. Now on the like just learning everything that you're saying and other doctors, clinicians, whoever that might be, that's gone through the research and training and has a care for people. It's like, yeah, well, why wouldn't we want to improve our diets? Why wouldn't we want to watch better things instead of not so good things that can ruin our cognition? It's like everyone would do good in seeking a better diet and better, more educational, informative. So it's like even personally, like on the neurotypical, we seek for that. So yeah, it's very fascinating. Like just learning a lot from what you're saying. Trying to fit all of it in. I'm gonna have a lot of questions if we follow up after this, but
no problem. I'm happy to always answer questions. And I mean, the big thing is the autism, just to kind of make it clear, ASD and autism is a DSM-5 diagnosable condition. As in you have to meet certain criteria to be able to carry the diagnosis, and it unlocks certain therapies and certain supports when you have that diagnosis. The neurodiversity movement and the neurodivergent movement is about accepting that there's a variance within neurology, but that, like somebody can have ADHD and no autism, right? Somebody can have autism, no ADHD. Somebody could have apraxia of speech, no autism. So they are very clear diagnostic criteria for each until basically the American Medical Association or the American Psychological Association changes that. That's what doctors are going to always go by, and clinicians. But just because somebody carries the diagnosis, it doesn't mean kind of that they that they're, I guess, less than, right? And that's kind of what I'm trying to, even also ADHD children, a lot of people will say they use things like ADHD, OCD, or narcissist, or things like that. They use them in like everyday language, but those are diagnosable conditions that people do really struggle with. And so some people with ADHD, the symptoms are really strong in them and it can be very debilitating, while others may not have as debilitating. So girls with ADHD are much harder to diagnose versus boys. Girls tend to internalize the hyperactivity. It tends to come out in perfectionism. They tend to not do well with criticism. They tend to take on too many projects. like things like that will be girls with ADHD tend to have, and they're usually diagnosed much later in life. Boys with ADHD, the hyperactivity tends to be more overt. And so they get diagnosed sooner because we tend to see it. But there are two types of ADHD. And that's a neuropsychologist would be really the best person to talk to about this. But like, it's just one of those where I want to iterate that these are each individual diagnoses, like the same with OCD. It's an anxiety disorder. It's not just being particular about how things are, right? It causes the person with real OCD, it causes them severe pain to not complete a compulsive task. That the compulsion releases the anxiety. So a lot of children, actually a lot of my autistic patients will have a coexisting OCD diagnosis that very often, and that's where you see that compulsion that some of the autistic kids will get, where they only like things in a certain way and they have to complete it in a certain way. It's because of that rigidity and that like that compulsion to release that. So I always implore people to try and not use those terms lightly, because it can be painful to people who actually who feel it for real. But more to do with accepting that when somebody has it, that we accept that who they are for who they are, and that they're not less than because they have it.
Yeah, that's so good. That's so good. I wish. I feel like I want to have that panel of like the neurologist or like different clinical professional experts and have that longer discussion, because it like I was kind of alluding to, and you were saying like we just throw it out in layman's terms that, oh, my OCD is kicking in or whatever.
Mhm.
It's like, again, maybe there's I don't know if it's a percentage or everyone's brain has that capacity for that, but like you said, it is an actual DSM 5 disorder.
Yes, it's a diagnosable disorder. Yeah.
Yeah, that's very fascinating. I, I know this could go on for hours, and I know you're busy. We have our lives to get in order. But kind of wrapping this up, what would you say are the 3 to 5 foundational things or most important things that children with autism, with other special needs, let's say from elementary school to high school, just for the sake of our audience and the parents and teachers listening, what are those foundational things that those students have to have in order to post high school uh, be integrated with society, with their family, with maybe it's work, whatever that might be. Do you have any tips around what those things are that they should?
So just to make sure before I answer that I understand what you're asking, is that you're asking me if what are the, like, I guess 3 or 5 most important things that I would feel are needed for an autistic individual to have in order to be successful post high school?
Yes.
So number one is communication. Number one is communication. The child has to have a means of communication. The individual has to have, and that needs to be any communication. It's not verbal. It can be verbal, it can be through a device, it can be sign language, it can be a combination of all three. But the reality is that child has to have communication, functional communication. The second is they need to be able to either regulate themselves or learn how to ask for the tools to regulate.
Which goes back to the communication.
Which goes back to communication, right? So the other thing that, and things like being able, now they can be that rigidity that, autistic individuals tend to have. I would say it's not something we should fight. So there needs to be, number three, an acceptance of some of the parts of who they are as just part of their personalities. Just like we would accept if a neurotypical person like was a certain way, we wouldn't sit there and try and tell them that they had to change, right? So I would always make sure that whatever if I was a high school therapist, which I'm not, but if I was, and I was guiding parents on the next steps, I would say, okay, let's look at jobs that meet their most natural, like how they are the best naturally, so they don't have to fight themselves so much. So, if you have a child who's hyperlexic, who loves numbers and letters and things like that, and maybe they like computers, maybe go into coding, maybe go into software engineering, maybe go into gaming programming. There are things that you can teach the kids that, can become very successful. Funny enough, a lot of surgeons sometimes are on the spectrum, because they can disconnect from the emotions, right? So people who are very emotional or very empathetic emotionally may not make the best surgeons, because your surgeon, you want them to be able to cut, right? You need them to be able to stay on task. You need them to be able to be good under pressure. So that takes a specific skill set. So, you want people now, autistic individuals don't tend to do all that great with quick changes in schedules, very like too many ups and downs during a day. So jobs that require way too much juggling of different tasks may not be the best option for them. Now, that doesn't mean across the board they're all like that. I'm just saying, the third most important would be to always make sure that whatever job you are lining up for your child or for the individual, it matches their natural abilities to the best, because it would be what we would do for a neurotypical person. If somebody was really bad at math, you wouldn't force them into an engineering job or an architect job, right? If they were really bad at math but really great linguistically, like, you wouldn't do that. If they were really great, if they're terrible, if they had dyslexia and they're terrible at reading, or not even dyslexia, they're just neurotypical, but they just are really, analyzing language is hard. Maybe don't be an attorney. That might be really difficult, right? Interpreting law might not be the right job for you. So that's why I kind of say it's not, there are so many jobs out there now. If your child has, and then the social aspect. So there are, I think one of the most important is figuring out how the social aspect works into an autistic individual. Now, I had a neuropsych one time tell me, which I think was so enlightening, and I always think about it. When we as neurotypicals, when we look at autistic individuals playing by themselves, right? Or sitting at lunch by themselves or whatever, we feel bad for them. We think that they should be with friends. We think that they need to be surrounded by people all the time. But she told me, she goes, you feel that way, not that child, not that individual. That individual is actually perfectly content playing by themselves in the corner. That individual is actually very happy eating lunch by themselves without all of that extra input. And so they're like, don't push out onto them what your interpretation is, because that is their world and they're happy there. So really getting an autistic individual to be able to express, and this goes back to communication, express when they're feeling certain things, so that people who are neurotypical don't misinterpret things and then force them into situations that are uncomfortable. Because what we tend to do is we go, oh, look at that poor child, they're sitting by themselves, they need friends. And then we try and force the kid to have friends. That kid maybe doesn't want 4 people around them. Maybe 1 friend is more than enough. Maybe they only can handle 1. And so we have to be okay with them having 1. Like, I do think you know, it's not no friends, but like if they have one good friend, they don't need to be the quarterback of the football team, or, you know, they don't need to be that. They can be, they can have one friend that they go through school with, that they're close to, that understands them, and that may fulfill them. It may not the parent, it may not the clinician, it may not be the teacher's interpretation, but the child and the individual is happy. And that's like, that's the most important, is really don't project your view onto that kid, because you may be misinterpreting something. So always making sure to learn how to communicate with them. And then I would say the other most important thing, which is actually something I do in my consulting firm, is finding a place to work that is neurodiverse, accepting, and open, right? So if you need something that's more flexible in your schedule, if you, whatever, things like that, you may need to be able to work. So to have more inclusivity for these individuals, I think that goes back to my first point, where I think at schools, we need a shift in how we work with the kids. And I think in the workplace, we need a shift on how we work with these individuals, because there is there's an increasing number of autistic individuals now. Now, that's a whole nother podcast, a whole nother debate as to why that's happening, but there is. And so that means that there is going to be more in the workforce, which means that employers, companies, etc., we have to tailor to that to a certain extent. That doesn't mean change, you know, favor them or anything like that. But, you know, if you can make accommodations for them to be able to be productive members of society, then we should.
Yeah, that's so good. Really well put. No other comments and nothing to add. I think this was fascinating. Just thank you for your insights and willingness to jump on. And you know, a lot of this, even for me, is not having gone through a lot of the research. It's just very surface level. I mean, I'm curious about it to go learn, but it could be challenging or burdensome for others. But just thank you for kind of pulling back the curtain and shedding light on this. I guess to wrap this up, you know, this has been helpful. I'm sure people would want to connect with you. Where can they find you? How can they connect with you if they have further questions?
So I can be found on Instagram, on TikTok, and on Facebook. So my Facebook profile is like, you can find me, but what I tend to do is I have a clinician group for clinicians and one for parents. So if you send me a daily, like a dedicated message, then I can direct you to those groups that I have. And then that gives you access to ask me some questions. You can find me under Katherine Wallisch. So it's Wallisch would be the last name, Katherine with a K. On Instagram, it's Wallisch Associates 22 is the handle. So you could find me there. And then on TikTok, it's at Wallisch Associates. There's no number. And you can find me there too. And that's, I haven't posted much in the last month and a half. I had some personal stuff come up and I've just not been as present on social media as I normally am. But usually what I tend to do is I try and post like something once a week, and I do videos, and you know, and I have a podcast called Autism and Brain Institute, and I have another one called the AAC School, which is brand new, which I haven't posted anything yet on, but I will be posting an episode on that. So the AAC School is for clinicians, and the Autism and Brain Institute podcast is for families. And it's all about, so when you get sometimes families will feel overwhelmed by all the information I tend to give them. So the podcast is a place where you can listen to it at your own time when you feel calmer, especially if I give a family a diagnosis of autism. it can be very, very overwhelming to hear that. And so your brain doesn't quite go through all that right away. So the podcast is there to really help later on.
Awesome. Wonderful. Well, I think I have all the links, and I'll link them in the description. Thank you
Perfect.
so much,
Thank you.
Catherine. I'm looking forward to hopefully some future discussions, maybe
Absolutely.
panel discussions, and
Panel discussions are always amazing. Always
for
getting
sure.
the insight from all the physicians is very enlightening. I think families tend to not know what physicians to go to, so giving them that opportunity to kind of know where to go is just very helpful for them.
Yeah, absolutely. Couldn't agree more.
So thank you
Awesome.
so much for having me, and I
absolutely.
really appreciate it. And looking forward to future discussions.
Awesome. Wonderful. Thank you. Talk
Thanks.
soon. Bye.